Welcome, colleagues and esteemed listeners, to the Ghana Dental Association podcast. My name is Dr. Awua Mensah, also known as Dr. Awua. Today, we're going to explore the intricate relationship between oral health and mental health. As you all know, this year's World Oral Health Day theme is a happy mouth is a happy mind. Today, we have Dr. Sedohia in the studio. I'm sure you're wondering, who is Dr. Sedohia? Dr. Sedohia is a specialist psychiatrist working currently at the Psychiatry Department of Kolebu Teaching Hospital. He has worked at the Psychiatry Department of Kolebu since 2013. Along the line, he worked partly at the Accra Psychiatric Hospital and the Pantang Hospital. On private basis, he works currently as the specialist psychiatrist for Accra Medical Center and the Yahoo Medical Center. As an additional duty, he serves as a clinical tutor at the University of Ghana Medical School. His passion is to impact and empower as many people as possible with accurate mental health information and help anyone with mental health illnesses, as well as contribute massively to the global aim of destigmatizing mental health illnesses. Dr. Sedohia, welcome to today's show.
Thank you, Dr. Awua.
Dr. Sedohia, before we start, I'd want to find out, on a scale of 1 to 10, 1 being very terrified of the dentist and 10 being you loving to see your dentist, where would you place yourself?
Because I have colleagues who are dentists, who are my dentists. Yes.
So you'd say that the last time you visited a dentist would be?
Last year. I've actually missed my appointment though, but I was there last year.
Oh, I see. I hope
Yes.
you'll be able to go this year.
I will, definitely have to.
Great. So, Doc, do you know about the World Oral Health Day?
It's news to me, actually, to be
Really?
honest. Yes.
Every 20th of March, we celebrate the World Oral Health Day, and it's something celebrated globally. And this year's theme is a happy mouth is a happy mind.
Yes.
Do you agree with me?
100% so.
Wow. Then today we're going to delve into that and talk more about
No
it.
problem.
So, Doc, how would you describe the fundamental connection between oral health and mental well-being? How is the link? How is the link like?
So it's a two-way affair here. It's bi-directional. It goes both ways. So oral health affects mental health. Same as mental health affects oral health. Now, as something that I'm used to doing, anytime I have opportunity, I always want people to know what we mean by mental health, because a lot of people have, let me say, limited knowledge of it, or they have a misunderstanding of what they call mental health. Because most people, when they hear mental, anything else that follows, they don't want to hear.
At all.
They don't want to hear anything that follows. Okay, so health, we know, is a good thing. So mental health is synonymous with mental fitness. So mental health is actually a state of complete well-being where an individual is able to cope with their daily normal stresses of life. They're able to work, learn, realize their full potentials and contribute to the larger society. Is that not something you want to have?
Most definitely.
So mental health is a good thing.
Yes.
On the other hand, what people confuse mental health with is mental illness,
Right.
which is anything that affects the way you think, behave, and
Yes.
how you think, feel, and behave. Anything that affects it negatively.
Right.
That is mental illness.
Ooh.
So when somebody says, I have mental health, and they think they are trying to tell you have a mental illness.
Yeah.
No. Everybody deserves to have or be in a good state of mental health.
Right.
So like I started earlier, oral health affects mental health, and mental health also affects oral health. For example, how oral health affects mental health. If you have bad mouth odor, halitosis, you would definitely have low self-esteem.
Most definitely.
You're most likely going to occupational functioning, and your confidence level will be way low. And if these things persist for a minimum of 2 weeks and beyond, and it's impacting on your occupational functioning, your educational functioning, your individual life and all that, then you are going towards depression. So bad oral health, halitosis or bad breath, now has led into mental illness.
Wow.
Now, on the other end, somebody who has a mental illness, the commonest one, which being depression, is likely to neglect their health, their oral health. So they mostly neglect their personal hygiene, key among them being their oral health. Somebody with schizophrenia, which is a chronic mental illness, is likely to also neglect their personal hygiene, key among them being their oral health. Now, once you neglect your oral health, you know what happens.
Yes.
Low self-esteem, and then it just worsens the mental illness as well. So it's both ways.
So it's a whole cycle.
So it's both ways. This one affects this one and worsens it. Also, people who have chronic dental pain. The chronic dental pain can affect your sleep very, very badly. It can make you very irritable. So, like, because you're in pain and it's chronic, and mostly it's the tooth at the back here, these ones, the wisdom teeth, mostly, because you're in that pain and it's chronic, you become irritable. Something very little, you just shout at a person. But that is like from 0 to 100 over in 3 seconds.
That's not you.
No, that's not you. It's because the person is in chronic, is suffering from chronic pain, and that also affects. It leads to stress, anxiety, irritability, and if it affects your, of course, your functioning as well. So that it goes both ways. Another way, oral health, let's say mental health, also affect oral health is an eating disorder called bulimia nervosa. So bulimia nervosa, the individual is not, just put in a layman's term, is not happy about how they look. So they binge eat and then they induce vomiting.
Hey guys, are you listening?
So they buy a lot of, let's say, kinky, let's calm down. So eat 4 or 5 balls of kinky and they just binge. 5. I'm just taking it to the extreme. So they eat a lot and they just induce vomiting. Now this frequent vomiting exposes the teeth actually, to acid. And the acid will wear out the outer layer, which is the enamel.
Exactly.
And that means the tooth is likely to suffer infection, discoloration, become weak. So that's how mental illness, being bulimia nervosa, affecting oral health. And then the frequent vomiting can also lead to other things like ulcer and all other things.
Wow.
So it's a bi-directional thing. It's two-way affair.
I really agree. It's bi-directional. So in as much as somebody doesn't take care of their oral health, it can lead to mental illness, and mental illness too, if they neglect certain things, it also leads to oral illnesses as well. Great. So Doc, this year's theme emphasizes that a happy mouth is a happy mind. In your professional experience, how often do you see oral health cases or issues impacting the patient's mental state at your clinic?
Oh, it's like I stated earlier, it's a common thing. So depression, before you say somebody has the clinical depression, the symptom has to be there pervasive for at least 2 weeks.
Right.
So when the person comes to you looking, in the layman's term, depressed, and all the accompanying symptoms, neglect of personal hygiene is one of them. And then you will notice from that examination, physical examination, that they may have discolored tooth. They may have a stench, a bad mouth odor, which you can perceive across from the exactly. And aside other things, maybe their hair and other things, their clothing and everything else, you may perceive that one as well. So it's a common thing you find in people, especially severely depressed, some who are even catatonic, and people who are living with schizophrenia. So it's a common thing you find.
But is there a chance that some can mask it that well, they'll dress nicely and all that, and you wouldn't be able to pick up some of these salient features?
You're talking about the mental illness bit?
Yes, the mental illness bit.
As for mental illness, it can go undetected for years. Depends on how it presents. Mostly in our part of the world, we get to detect it when it's mostly moderate to severe forms. Yes, because again, the awareness is quite low. So many people will attribute any unusual behavior of anybody to a lot of things, including spirits, apart from coming to...
Really?
Yes, we are highly overly spiritual. Sure. Everything we want to pray about it. God himself, he's tired. Because some of the things that he wants us to do ourselves, we prefer to hand it back over to him when we know that he can't do certain things.
Yes.
Because he expects us to do it. So, yes, some symptoms can be masked.
Right.
So, for example, you have a corporate executive. He may be the CEO, he may be the MD, the GM. Out of respect, he may be doing certain things that may be a bit off. People have noticed, but because he dresses well, speaks good English, so nobody believes. I've had lots of those instances where the individual is very sharp. He speaks impeccable English, so everybody thinks he's okay. Until you start challenging their delusions. Those are the fixed, false beliefs. You understand? Right. So until you start challenging them, then you notice the symptoms manifesting. But on a normal day, they go about their duties just as everybody else.
Wow, wow, wow.
The same as oral health can also be masked.
Yes.
You know, yeah. If you have a discolored tooth, the person may choose not to laugh.
That's true.
Nobody,
they cover
they
their
can
mouth
just, when they're about to smile,
Yeah.
as if they're being ladylike or being gentleman-like. So.
No, you really notice these things. So.
Yeah.
I see. So conversely, as you said, the mental health conditions, they can manifest or exacerbate oral health
Yes.
problems. So
Yes,
like
yes,
conditions like depression, anxiety,
Yeah.
these eating disorders,
Yes.
they can affect the oral
Definitely,
hygiene
yes.
habits. Oh, that's
And
that's
another
good to know.
very key one is social anxiety, where the individual is very critical about themselves and what other people think of them. Because of that, they may not even associate with people. And because they don't want to associate with people on a normal level, they will not visit a dentist. So if they have an oral health challenge, it will only get worsened. And when the oral health challenge worsens, their mental health also worsens. So it becomes a vicious cycle. You see how it goes. So they are highly interconnected, highly interconnected. But unfortunately, we don't talk about it much. The connectivity is not highlighted enough.
At all.
Truthfully, this is actually the first time I'm having to do this connection
Yes.
between oral health and mental health. And well done.
Oh, thank you so much.
Yes.
Thank you so much. And Doc, it's good you mentioned the social anxiety. Do you feel that it can affect the oral hygiene habits, like reduced motivation, fatigue, you neglect yourself, and you are not even visiting the dentist or brushing or flossing?
Yeah,
leads
definitely.
to that.
Because you have social anxiety, you don't want to come out and interact with people, so you wouldn't visit your dentist. And we all need help one way or the other. As I'm speaking to a mic to amplify my voice. I couldn't be able to do without this mic. We all have phones. We use data. So we all need help one way or the other. So if I have a tooth problem, of course, if I smile, there's a lot of money in my mouth, right? As I said, dentist, you can see a lot of money in my mouth.
A lot of
Yes,
money.
I know, you see that. But I don't mind. I'm confident to smile. That's you understand? So if you don't want to visit a dentist because of how you are overly critical of your look or how people see you, the condition will worsen. You might end up overly masking it, and it will keep worsening, and it will affect the other way around as well. So yes, social anxiety. So that's social anxiety. People who have social anxiety do not want to. They are overly critical. They are afraid of what people think about what they do, especially in social settings.
Right.
Yeah.
Totally agree with you. And Doc, can you elaborate the link between stress and oral health issues such as bruxism, that people those who grind their teeth at night? Is there any link, maybe as opposed to maybe the muscle tension causing the grinding? Can you elaborate on that link between stress and then bruxism?
Yes, stress leads to increased muscle tension. And the bruxism that you mentioned, that's the involuntary teeth grinding. Means the person is not even aware, but because there's stress, it will lead to increased cortisol. And that leads to increased muscle tension. And that muscle tension, the jaw muscles, those that are involved in clenching of teeth, grinding of teeth, will be working mostly awake or whilst you are sleeping. That's the bruxism, that's the involuntary clenching of your teeth.
Yeah.
So yes, stress leads to it. Psychological stress, physical stress, emotional stress, any form of stress can manifest as the bruxism, which is the involuntary gnashing or grinding of your teeth. Yeah.
Right. Because sometimes I have patients coming to the clinic because they've read something online.
Yes.
They know that whenever you grind your teeth, they're supposed to come for a night guard.
Yeah.
Some would even go to pharmacies to buy a mouth guard that is not custom fit, a stock mouth guard. So at that time, they put it in the microwave, it gets warm, they put it in and it fits nicely. So they come to us saying, oh, I grind, I want a mouth guard. But as you said, it's important that we probe further, find out some of their stress factors, things that are causing them to get stressed, checking if they take a lot of caffeine, that could also trigger that.
So what you just described is a typical example of how people who have anxiety behave.
Ooh.
Yes, so they hear something, then they go on the internet, Dr. Google. They read a lot about it and they want to implement some of them.
Yeah.
And they have a cognitive distortion we call filtering. So they are looking for the negatives only. So they have a symptom, they go Google it.
Yeah.
and then they see and read only the negatives of that symptom, not about how for example, if you give them a medication, typically if you give them a medication which we give because of a therapeutic effect, right, the benefit, not the side effects. We know every medication has possible side effects, but we don't give it to you because of that. But you go and read on only the side effects and not on the benefits.
Right.
So that's people who have anxiety mainly. So yeah, people who have anxiety, mostly stress is an underlying factor. So they've read something online, they try doing something about it, it's not working, they come to you, and then they may overdo what you advise them to do, or maybe underdo or wrongly do what you are asking them to. So stress, anxiety, bruxism, all can be mixed, can occur in an individual. So the stress can lead to anxiety, the stress can lead to bruxism. Somebody with anxiety can have stress as an underlying risk factor and can manifest as bruxism.
Wow. So those of you who always go to Google looking for answers, you should go and see your medical practitioner, your specialist. Whether it's your mind, your teeth, any part of your body, don't just go and Google symptoms and now you start getting all sorts of anxiety. It's important that you go and see your doctor. So, Doc, how might body image concerns or eating disorders impact a person's oral health?
So the commonest is bulimia nervosa, as I stated earlier. They binge eat and they induce vomiting. So the acid will wear off the enamel, which will lead to teeth discoloration, the weakness, infections of the teeth, and all that. And that as well, the acid, constant acid, will lead to ulcer. And that can also lead to bad breath and all that. So that's the body image is making the person binge eat and vomit, induce vomiting, because the person doesn't like how they look. Another body image issue is anorexia nervosa, where the individual will avoid to eat good portions of good meals because they are afraid they'll put on weight. I've had to manage some cases like that. They will intentionally avoid to eat enough.
Really?
They are almost always daily checking their weight multiple times. And when they look themselves in the mirror, they are not happy with how they look. They always want to lose weight and they just want to keep on losing, and they're never satisfied. You understand? So such people will lack certain vital nutrients, vitamin D, calcium, phosphorus, which is good for the health of your oral health, your teeth, your bones, and all that. So the anorexia nervosa, you avoiding to eat because you're afraid of your weight, because you don't like how you look, will affect your oral health in that way as well.
I totally agree with you. I really agree with you. So, Doc, how does the stigma associated with certain oral health conditions affect mental health?
Yeah, so oral health conditions like halitosis, most people, if not all, wouldn't want anybody else to know they have bad breath. So there's a stigma that it goes with. Teeth discoloration, most people wouldn't want anybody to know or to see them have their teeth as brown, black, or whatever, yellow, or whatever. So they wouldn't want to even go to the dentist to that extent. You see, so it can worsen the condition. So you already have a bad oral health, and because of the supposed stigma, you're not seeking help, and because you're not seeking help, the condition will deteriorate, and you are still not seeking help because it's deteriorating. Now you are isolating yourself. It's affecting your occupational functioning, your personal life, and everything else. So that's how it can also affect you negatively.
But it's good you mentioned the halitosis. I know halitosis, we have the genuine, you have the pseudo halitosis and the halitophobia. I've had patients who've come to me with genuine halitosis. You realize that it's as a result of maybe a cavity that food packed in, and then there was a bit of a smell, or maybe as a result of tongue contents, or maybe poor oral hygiene where you have to do scaling and polishing. You do that for the patient leaves, but the patient still has it ingrained in their mind that the halitosis is still there, just because when they were in class, grade 3, somebody told them that your mouth is smelling. Ever since, whatever you do for him or her, they still feel that the bad breath is still there. So in such cases, I've had instances where I have to refer to a psychiatrist for further treatment. But in such instances, how do you address it?
Okay, so when anybody reports you bad breath, Of course, the first point of call is the dentist.
Yes.
When the dentist clarifies and certifies that everything from the dental point of view is in order, then they're likely going to refer to us.
Yes.
That's where we are dealing with the psychogenic aspect,
Right.
which means there is actually not any bad breath, but the individual is perceiving it. Then it becomes more of a hallucination or delusion.
Oh.
So we have olfactory hallucination, where you are perceiving a smell which in reality does not exist. And that could be a symptom of a chronic mental illness. Then we're not just going to focus on the psychogenic halitosis. There may be other associated symptoms that it may come with. You may have other maybe depressive symptoms or psychotic symptoms or other symptoms that may be associated with it. So of course, you being the first one, of course, the dentist, once you rule out everything from your point of view, then the psychiatrist collaborates with you to help the individual. And once the individual is put on appropriate treatment and therapies, there is always improvement. Sometimes because, like you said, the person was told when they were younger that you have bad breath, so it's ingrained. It's like maybe the circumstances under which he or she was told, he or she has internalized it. It's been traumatizing. So the person assumes that's me. I always have bad breath. When everybody around you tells you no, it's not true, and the dentist actually confirms that it's not there, the person may still need some form of therapy, and maybe not always medication, but sometimes, if need be, because maybe it could be a symptom of an underlying chronic mental illness.
And even for some, when they take social cues like somebody pinching their nose, it's always a bit of a bother. They'll come to you and tell you that, oh, I was speaking with my work colleague and the person pinched the nose, so I presume that there's bad breath. They come to the clinic, I make my nurses check. You can't smell anything, I check, you can't smell anything.
Yeah, it can happen in two ways. Mere coincidences.
Exactly.
People may have tics of just doing like this.
Yes.
It's a tick. The individual has a tick. It has nothing to, it's not in relation to you talking, that's what, no. Or it may be, again, a delusion. So there are people who may think everybody else is talking about them. Just because they are passing by the marketplace or the public place or they're in an office space and people are talking and giggling, most likely talking about what unrelated stuff. He or she assumes it's them. It's called delusion of reference. He or she believes strongly. So when it happens like that, the person becomes confrontational. So he or she assumes you're talking about him. So he'll come at you. He's so sure you're talking about him or her. So he'll come angry with you, and imagine it's your boss. It just will be that. You understand?
Really,
so it could be that the person will have to understand it could just be a mere coincidence that somebody is just, maybe there's a fly that passed by, or the person is just, maybe not even you, most likely not you.
You.
Yes, it could be a mere coincidence, or it could be a symptom of a more chronic underlying mental illness, which we have to investigate, assess further, and then decide on the management that will be required.
Wow. It's good you've spoken about the management. So, how can dental professionals and psychiatrists collaborate to provide holistic care for patients?
Yes, because of the direct link, the bidirectional, the two-way affair, where your oral health impacts on your mental health, and your mental health impacts on your oral health. So we are supposed to be working together. So I see a client, we not, you know why, right? We work in silos.
Yes, we do.
The two specialties, we are like twins, because we are currently in Ghana, not that easily accessible. And not maybe, I might say, affordable.
True.
And for dentistry, you guys are never part of the mainstream.
So
You're in your own space. So if you're even back in school, you know how it is. Your building is different from the medical.
Different.
So we work in silos. So we this the link, the direct link between oral health and mental health is supposed to be advocated for and highlighted more. So I see a patient maybe severely depressed with bad oral hygiene. I'm supposed to refer to the dentist.
Exactly.
The dentist sees a patient who has bad oral health, who's looking sad and worried about their oral health and worried about how people perceive them and worried about their occupational functioning or whatever. Supposed to refer to the psychiatrist. A dentist sees somebody who says, have bad breath and you can confirm that there is nothing like that, you're supposed to refer to me. I also see a patient who has bad breath aside other symptoms. I will treat my side and ask you to continue. So we are supposed to work alongside.
Wow, wow, wow. We really have to work together.
We do.
We really have to.
Do.
And look, what are some psychological interventions that can help patients overcome dental anxiety or phobia?
Okay, so for that, we have some therapies, and of course, at the extreme end is the medication, which is almost always the last resort. So we can offer CBT, cognitive behavioral therapy, where the individual may have certain irrational thoughts, which we have to replace with healthy ones. Typical among them is where the individual says, the dentist will hurt me.
They always do. When they come to me, they say, I hate the dentist.
Why? Because the dentist will hurt me. So you have to replace that irrational thought, which is a negative thought, with a positive one, which is the dentist cares about you. He will use anesthesia to take off your pain. So what the person may just see, maybe the machine making sounds.
Yes.
And maybe the person wincing or something. That may just be a reflex action, not because the person is in pain. Because no good dentist will operate on someone who is in pain and continue operating.
Yeah.
You understand? So you have to replace that. Another thing we do is exposure therapy.
Okay.
So progressive desensitization. So there are people who will never go and sit in a dental chair.
At all.
Never. And they start from childhood.
Yes.
So they prefer to, I don't want to use the extreme word, they prefer anything except to go to the dentist. So what you can do is progressively desensitize them from that. So you can say, initially show them a picture or video of a dental setup.
Right.
Then the next one, they go to the dentist's office. Nothing is done for them. They just go there and see how the setup is in real life.
Yes.
The next time, they go sit in the dental chair. Again, nothing is done.
Yeah.
Then the next level, they go sit in a dental chair. Now they are comfortable. So now they are comfortable with the sight of the dental setup.
Yeah.
Now they are comfortable with being in the presence of the dentist or in the dental setup environment.
Yeah.
Then now they are comfortable sitting in the dental chair. You know, that chair is almighty, right? They can do everything in that small chair. Yeah. So now they are more comfortable sitting in the dental chair. Then the next level will be to have a simple procedure, a painless one, like teeth cleaning.
Teeth cleaning, yes. Yes.
When that is done for them, they go like, I've always thought when you sit in this chair you cry, but I didn't cry. Then later on, when they become more comfortable, you reassure them. Now, you know, and I'm sure you all, that's what you practice.
Yeah.
You tell, you show, you do.
Yes, tell us you do.
So you tell them, I'm going to do this. You show them how you're going to do it.
Yeah.
And then you do it.
Yeah.
It's reassuring. You carry them along so that they are not wildly thinking about, hey, what is it doing? Which part of my mouth is it now? No. So you see, you have to be compassionate.
Yeah.
You talk with the person along the process, compassionate. You are anxiety friendly, which means you know that this patient of mine is likely to have dental phobia,
Yes.
dental anxiety.
Yes.
Of course, you might be told by the mother or relative, or just like there are people who fear needle,
They do.
and you want to take a sample. You can't just bring your hand. I need your blood. You can't do that. Yes, you are doing them good,
Yeah.
but they have phobia. They have an irrational fear of whatever it is you are going to do for them. It's same with the dental phobia. So you have to progressively expose them to that as well. So those are some of the therapies: the CBT, the progressive desensitization, and there are other ones as well, like relaxation, stress. If you are stressed, there'll be bruxism. There'll be the pain will lead to stress, anxiety. So relaxation techniques such as mindfulness, where you are trained and taught to bring your mind here and now, and not be in your own world thinking all the negatives. The funny thing is when they're in their own world, they think only of the negatives. Because if you leave a human being, they only think negative.
Yes.
You understand? So that's mindfulness practice or deep breathing exercises.
Yeah,
it
that's
helps
something I've
to
tried
calm.
before.
Exactly. We all do it.
Yeah.
Even me, here, in this chair with you, I've done this severally to get myself well composed, to be able to So the deep breathing exercises, the mindfulness, and sometimes we call it guided imagery, where the professional helps the client to imagine a world of fantasy where they are at their happy place.
Yeah.
Where you see, as I'm saying, you're beginning to imagine somewhere.
Yeah.
Your mind is going somewhere.
It's going
It's going somewhere. Yeah, so you help them to live as if it is real in their mind, most likely with their eyes closed. And it relaxes you. Progressive muscle relaxation is one of the techniques we do. So it relaxes you as well. Yes. So those are some of the techniques we use to help these clients.
Yeah. Me personally, when I tried the first time I went to see a dentist,
Yes.
so prior to that, I explained to the dentist that I was scared of needles. So I asked all the questions that I could ask, and she answered all those questions for me. The other thing I also did was that I booked the appointment on a day that I know I wouldn't be too stressed. So for instance, I know maybe that's when I was in school. So I think one day on Wednesdays we're not having lectures. So I picked that day that I know I'm not going to be stressed or people will be calling me.
Mm-hmm.
And then when I was also going there, as you said, the relaxation techniques, I did a lot of the deep breathing in the morning before going there.
Yes.
So I was sitting at the receptionist waiting for the dentist.
Yes.
I'll do a lot of deep breathing.
Yeah.
And one thing I also did to distract myself was I took my AirPods with me.
Okay.
So I asked if it was going to be inconvenient
Music
to the dentist.
therapy.
Yeah,
Music therapy, yes.
So I put it in my ears. I was just listening to my favorite musician,
calm you down.
just to calm me down.
Yes.
And then also discuss with my dentist that I wanted her to have a signal if I feel a bit overwhelmed. So what I discussed with her was that if I feel overwhelmed, I'll lift my...
So that's a stop signal.
The stop signal.
Yes.
Please stop at this point. I feel a bit of pain.
Yes.
Or if the pain is a little, I point that, oh, there's a little bit of pain.
Mm-hmm.
And if I feel good, I give it a thumbs up that I
Mhm.
feel good. If I want them to, the nurse to suction my mouth, I do a signal like this. Then they
Okay.
know that they just suction. So I think doing that really helped me reduce my dental.
Did you know you were going to become a dentist at that point?
A little.
So, okay, all right, that's a good one.
A little,
All right,
a
okay.
little. So I agree, these methods really
Yeah, yeah.
do help. From
Yeah.
personal experience, they really do help. So guys, try it out and see.
Yeah, it's important for them to know that there is the stop signal.
Mm.
So if you feel uncomfortable in the dental chair, a good dentist
Yeah.
will allow you to instruct him or her to stop.
Yeah.
And they will stop
Yeah.
and ask you what the
Problem is.
problem is. If the anesthesia is wearing off or there's something that is unexpected that's happening, you're not going to have their pain threshold levels.
Yes.
So, yeah.
Some you give them so many injections, but they still feel the pain.
Yes, especially those who take alcohol.
Yes. we face that a lot at the
Yes,
clinic.
yes,
Yeah,
yes,
yeah.
yes.
So, Doc, what advice would you give to people who are struggling with both oral health and mental health challenges?
That being said, first of all, if you're having both issues, you need to work with both specialties,
Yes.
dentist and psychiatrist. One category of people that fall classically in that category are people who use substance drugs.
Oh, it's quite common.
Extremely.
Yeah.
People who smoke weed,
Yeah.
cigarettes,
Yeah.
and use other substances.
Recreational.
They have their teeth discolorations and all that, their lips and all that. So the solution is you have to work with the two specialties, the psychiatrist, because the psychiatrist will come in, especially with the drugs, to help with the detoxification, the rehab process, and all the therapies that are needed. The dentist will come in with if there is need for dental restoration, if there is need for scaling and polishing, cleaning, the dentist will do all that for you. So it's both specialties have to work together all the time. So if you are having challenge with both, in fact, chances are that if you have one, it will impact on the other.
Yes, it will.
So it's a multidisciplinary approach that always has to be, yeah.
Yeah, Doc, it's good you spoke about the cigarettes and then the weed,
Yeah.
the smoking. It's quite common amongst the youth.
Extremely.
I remember from personal experience, I had one client who came to me and to take out his badly decayed wisdom tooth. I took it out and I advised him as part of the post-op instructions, do not go and smoke. And this guy constantly smokes every single day. So for that,
Did he go back smoking?
Doc, I'll get there for 2 weeks. I told him that for 2 weeks he shouldn't smoke. Oh my God, 2 weeks. I was like, yeah. In order to help the wound to heal perfectly, you don't have to smoke. And he agreed with me, but I knew he made disobey me. But truthfully, this guy avoided the smoking. So 2 days after he came to me, Doc, Charlie, it's very difficult to. I'm trying not to smoke, but when did he say I can go back to smoking? I said 2 weeks no smoking. Came back a week later. Doc, check the wound. If that's healed well,
So I go back.
I go back. I was like, my friend, it has not healed well. Wait, Doc, 2 weeks exactly. This guy walked into the clinic. Doc, I think the 2 weeks is take out the stitches.
And let me go and
Yes.
Yes.
So I checked the place and healed well. I kind of took the stitches off. he left. I was like, Doc, thank you very much. The
He's
guy
going to
was
smoke.
happy. He was going to
So
smoke.
let me explain what is happening. So addiction now has been accepted as a chronic brain disorder. Now, why he is not able to stop on his own immediately is because of the withdrawal effect.
Right.
So it's never practical. He won't stop. He can't just stop. You're even lucky he did some few 2 weeks for you.
Yeah.
So again, that brings aboard the collaboration between psychiatrist and a dentist. So the dentist has figured a problem, which is being caused by the smoking, right? And he can't just stop at the go because he will go back because of withdrawal. So the psychiatrist will come in to help manage the withdrawal effect. So it's cigarette, the person is smoking. Is it cigarette? Good.
Cigarette and weed.
Cigarette and weed, good. The killer among the two is actually the nicotine.
Right.
It's easier to come off cannabis better than nicotine. Nicotine is highly addictive. Now with that, telling the person to just stop is not practical. So this is what happens. You have to do replacement therapy. So there's nicotine gum, there's nicotine patch.
And it's
So that's what he's, and the spray. There's even lozenges, all that, nicotine as replacement. So within the, ideally he's supposed to go back, he's supposed to not smoke again, but we do it gradually. So stop smoking, but start this nicotine lozenges or maybe gum.
the gum, yes.
You give their different doses, 2 milligram, 4 milligram, 8 milligram, 16, and all that. So you give it to them. And when they are on it, the withdrawal effect, the physical withdrawal effect will not worry them that much. So they are likely to be able to hold off and stay off it. It is the psychological withdrawal that they will need help with. That's where you need motivational interviewing, you need psychotherapy. So that's why we have to work together.
Together, that's true.
So telling them to just stop impromptu or at a go, all of a sudden, will be very difficult for them. And you see, when it comes to drug addiction, initially the person starts using the drug. Then after some time, the drug continues to use the person. When you get to dependence, so before dependence, so you start using occasional, then regular, then you are now addictively using. Tolerance setting, which means the same dose you use will not give you the same effect. So you need a higher dose. So one stick of cigarette will not give you the same effect as you used to. Now you are doing 3 sticks. Next, you are doing 10 sticks. Next, you are doing 30. Now you are now doing packs. You understand? So we have people who smoke 10 sticks before they brush their teeth.
Sure.
Yes, 10 sticks before they brush their teeth. In the afternoon, about 10 to 20 become dependent on it. The body is now able to function semi-okay because of it. Same with people who are addicted to alcohol. They have what we call eye opener. If you're a rich person, you have whiskey on your desk or your fridge or whatever. If you're in the village, the blue kiosk is just a stone throw away. Or you have that petition under your bed. So you take it before you wake up. That's an eye opener.
Oh, they take it before they wake up.
So they are from the bed, they just reach for the drink before they start their day. That's the eye opener. So again, if the person is on alcohol and you want the person to go off, it's not practical.
What about those who take a lawyer before they eat? They call it lawyer.
So that's how it actually starts. Appetizer.
Appetizer, yes.
So again, you start gradually. So you used to take half a tot, supposedly to boost your appetite.
Yes.
Then after some time, it doesn't boost as much, so you take a full tot. Now two tots. Somebody will say, what's the size of the tots? So the size of the tots will increase. And then now you're doing occasional.
Yeah.
Then it becomes regular. Every day you have to take it before. Then your occasional becomes regular. Regular becomes compulsive use. So impulsive use, maybe from peer pressure or from whatever. Now, maybe because of availability or affordability or whatever, easy accessibility, now you have compulsive use, which means you have to use it. Without it, you can't function. So that's the stage where your client was. He was at a stage of compulsive use. So stopping abruptly will worry him, health-wise. So that's why the collaboration. So he needs to go off it gradually. And most of them may not be able to do it on their own after the detoxification phase, where we deal with the withdrawal symptoms, because some of the withdrawal symptoms can be very life-threatening. Yes. So after we deal with the detoxification phase within 7 to 10 days, they may need to go to a rehab facility, either residential or outpatient. So it's a whole thing. Now this is a word of caution. Addiction is very expensive when it comes to rehabilitation. So your best bet is not to start. You may think you are enjoying the weed now, but in 5 years' time, When you become a junkie, to get you back functioning, it's going to cost you. Let me give you a fair idea.
Yes.
So your detoxification phase is going to be about 1 week. You're going to spend about, let's say, 3,000 to 5,000 Ghana cedis minimum during the detoxification phase. Drugs, admission, and everything. Let's say 5K. Then you go to the residential rehab. You're spending about 6,000 to 7,000 monthly for at least 6 months. Aside, if you have dual diagnosis, which is a mental illness plus the substance use, it could be that you are using the substance to cope with the symptoms of the mental illness, or the substances induced or precipitated the mental illness, or the substances caused. You understand? Or it could be both ways. The mental illness can make you use the substance. The substance you are using can cause the mental illness. Cannabis-induced psychosis. It can be somebody with schizophrenia with comorbid cannabis use. So it's also both ways. If you have a dual diagnosis, it means you are going to be on medications. Aside your 6,000 to 7,000 monthly, you are going to be paying. Aside your relatives and friends who will be visiting you, and every other thing. So it's quite expensive. Now, if you are aware of this, would you want to start a cannabis?
No, not at all.
You would drop that joint.
You drop that.
Yes.
Drop
But
that.
look, most people don't know. They're just following friends. It's like what everybody is doing. It's fun to do. And it's quite heavy and common among creatives.
Because they want the very
The
high
high.
output.
They want to be high on stage. They want to stay up late.
Yeah, the musicians
So,
do that a lot.
a lot.
They high before they go.
And now, because of social media, we have supposed influencers
They actually show that.
who are showcasing
Gosh.
the use of these substances live. So the youth think, that's my idol. If he's smoking publicly, it means it's allowed. That you are outdated. Do you understand? So that's where the challenge is. But people need to know. Nobody starts out to become a junkie.
No. It's gradual.
It's a gradual process, and then you lose it. So addiction literally is loss of control of use of anything.
Wow, interesting.
So you see the collaboration. So the dentist finds this thing. You want the person to stop smoking because smoking or the use of the substances is detrimental to the person's oral health. But we know that they can't just go off it. So then they need a psychiatrist to come in with the medication part. That's how
so it's very important that
the
we take
detox
that,
and the rehab.
we take that social history to know that
Key.
whether they smoke, alcohol use, and all that. And once we see that they're on a spectrum, we need to work with the psychiatrist.
Because nobody will smoke one stick of cigarette and have a problem with their teeth. For the smoking to cause something, it means it's been chronic. They've been doing it for a long time. And most often than not, the amount of sticks they will tell you, they will highly. If they smoke 20, they will tell you roughly 35.
Because they feel that if you do, you'll be judged.
Yes.
Wow. And look, you mentioned the nicotine gum, the nasal sprays and all that.
Yeah.
How common are these on the Ghanaian market?
It will surprise you. It's available. Trust you me. Nicotine gum is available. I get it from my clients all the time. It is a part that's quite a little difficult to get, but I don't know if you look how do you get. You see, that's the thing. Awareness is a big thing.
Yes,
Nicotine gum is available. I can mention pharmacies that have it, but I'm not here to advertise it. But it's available. Get to your doctor, he prescribe. It's available.
The patch.
The patch is what is a little difficult to get, but even that one, people who need it, we're able to get it for them.
Right.
So we have the nicotine gum, the lozenges, the spray. It's available. Just that most people are not even aware.
They are not aware. That's
Yes,
true.
it's available.
Yeah. Wow. That's good. And Doc, let's come to your broader societal implications. How can public health campaigns raise awareness about the connection between the mouth and then the mental health? How can we have very effective campaigns to raise this awareness about this connection?
That's what we've been doing for the past 30 minutes. And like today is the first time I'm having to join a colleague to bring about this connection. You're a dentist, I'm a psychiatrist. And here we are having a discussion like you brought up a patient. So your client, you're working on his tooth, he needs to work on his addiction. So I come in to help with the medication, the detoxification, the rehab, the therapies. And then you continue with the oral health, I continue with them. So education, awareness creation is key.
It's key.
Through this, I know somebody knows that, hey, this cigarette that I'm smoking can affect my brain. True. This condition that I have, the depression, the schizophrenia, whatever I have, can affect my oral health. So not only are we going to be concerned as a psychiatrist about, is he taking his medication, is he coming for reviews? No, we should also be concerned about how is his hygiene?
Yeah.
If it's not up to par, then we quickly refer to you.
Yes, that's true.
So campaigns like this helps a lot. It goes a long way to get people conscientized to know that both your oral health affects your mental health, and your mental health affects your oral health as well.
Yeah, I agree with you.
And there are lots of other ways, because we're in a social media age.
Yes.
So it's easy to use catchy phrases. A healthy smile is a healthy mind.
Yeah.
Catchy. Then you collaborate with, say, some influencers. Like you initially told me, you guys are already doing very brilliantly. So you work with, because people listen more now to the influencers than than everybody else. In the past, you used to listen to your grandparents and your parents, but these days, after 15, 18, it is your idols.
Your idols.
Whatever they are doing is what you want to do, and your peers.
Exactly.
So it's good to have influencers on board who understand the message, who can pass it on to them in ways that people will be more receptive to. It can be through comical acts.
Yeah.
It can be through skits.
Yeah.
Exactly. These days, they're all over.
Yeah.
It's a whole business, a whole industry. So it can be through skits, it can be through theater plays, it can be through videos, advertisement on radio, on TV. Any means, and you can also have outreaches.
Right.
At places like schools,
Yes.
churches, workplaces, where you let them know the link between the oral health and mental health. Because these are the places that you see people. School, you get the young ones there. And even in the university, you get lots of people there. Workplaces.
Workplaces especially.
There's a lot of stress at the workplace.
A lot of stress.
So you can imagine the amount of brutism and at the workplaces. Depression and all that. Especially those in the financial world. So
the auditors.
I've had a mental health awareness group for some group of financial trust union. That's their problem.
Yeah.
They never sleep. They are always up. Numbers. So schools, workplaces, churches where people gather. Imagine going to a church and you have the permission from the senior pastor, and he's also in agreement with you about a healthy smile. It's a healthy mind, and he uses it to preach.
Yeah.
Do you understand? Or he endorses the message. People will take it from him than you who have gone to school for so many years. So you use
add it to the ceremony
nice way. Cleanliness is next to godliness. So if you are clean, means your mouth has to be clean. And your mind also has to be clean. So you find a way of linking the two. So those are the ways that campaigns can go along. Social media is big. Hashtags.
Very big.
And
very big. Yeah. TikTok, X, Instagram,
all over.
YouTube shorts.
Yes.
They use it to propel propagate their message.
Yeah.
So finally, Dr. Sedohia, what is the most important takeaway you would like the audience to understand? That's about the relationship between the mouth, a happy mouth and a happy mind. Your most important take-home message.
Yeah. What I would say is they go hand in hand, and throughout our interaction, that's what we've been trying to highlight. A healthy mouth will lead to a healthy mind. Definitely. And a healthy mind. If you are in a good state of mental health, you will take care of your personal hygiene. You cannot leave your hair undone. You cannot choose not to brush your teeth. You cannot choose not to bath or wear tattered clothing, or you cannot even repeat clothing the same day because you're in a good state of mental health. Do you understand? It doesn't have to be new clothing, but it just have to be clean. So they go hand in hand. And there is a need for us to collaborate more. The psychiatrist, and then the dentist, and then the psychiatrist. And most importantly, our clients, the public, they have to know that there's a direct link both ways. If you have a good mental space, you have a good oral space as well. So that's what we want people to know. And it's quite coincidental that the World Oral Health Day this year is themed
with the psychiatrist.
So the happy mouth
is a happy mind.
Yes, because the experts know that there's a direct link between a happy mouth and a happy mind, because the connections are quite clear, very clear.
Very clear.
Very clear.
Very clear.
Yes.
Wow. Oh, Dr. Sedohia, I really enjoyed today's session.
Same here.
Very insightful conversation. There are a lot of things I've learned from you that I didn't know. And I've also learned as a dentist, learned the importance of the collaboration between the dentist and the psychiatrist. And I feel our association should be able to have talks with your association whenever we are having events, we're doing talks and all that. We have that collaboration. And even at the clinic, if there are even hot numbers that we can even call,
Yeah.
very fair cases to, and the same for your side to for you to also refer cases. I think this collaboration will really go a long way,
Yes.
not just to help ourselves, or help our patients as well, because as we also mentioned, a happy mouth is a happy mind. So we really need to work collaboratively to have this a success. Yes, thank you so much, Dr. Sedohia.
Welcome.
Guys, I hope you learned a lot today. It's been really insightful for me. I'm sure it's been insightful for you as well. So we would like to wrap this up. Don't forget to subscribe, hit the like button, share, comment. In fact, share to all your friends and family. And make sure that you also check out our audio podcast on the Apple podcast, Spotify, and Audio Mac. Thank you so much for joining today's session. Thank you. Fantastic. Oh, this was
Okay.
really good. It went